My name is Idam Qureshi, and I am an internal medicine physician at Bella Health and Wellness Clinic. If you haven't already, please check out our previous videos on COVID-19, and please join us for our live Facebook feed on March 25th at 5 p.m. Central Standard Time, where we will be able to answer your questions based on the most current data available at that time. Just a quick update. We currently have 7,769 cases in the United States. 83 of those cases are in the state of Texas and 30 reported cases in the Dallas-Fort Worth area as of March 18th. There is currently a vaccine that's going into clinical trial for COVID-19, and multiple studies are in progress to come up with a possible treatment. We've talked a lot about what to do to avoid getting COVID-19. However, we know that 40 to 70% of us are going to get this virus. So what should you do if you're sick? First, let's talk about the symptoms you need to watch out for. As you all know, we're still at the tail end of flu season, and spring has come in Texas, so everyone's getting seasonal allergies. So how do you tell the difference? When you have allergies, your most common symptoms are going to be coughing, sneezing, congestion, headaches, runny nose, itchy, watery eyes, fullness in your ears, and throat irritation that comes from a postnasal drip. When you have the flu, the most common symptoms are going to be fever, cough, sore throat, runny nose, congestion, muscle and body aches, fatigue, and headaches. Remember, seasonal allergies will not give you a fever. For COVID-19, the most common symptoms are as follows. Cough is present in 60 to 80% of patients and can be with or without phlegm. Fever is present in over 75% of patients, but 50% of them did not have a fever when they initially presented. A fever is defined as a temperature of 100.4 or higher. Shortness of breath is present in 20 to 40% of patients. Sore throat, runny nose, and headaches are present in about 15%. And GI symptoms such as nausea, vomiting, and diarrhea are present in about 10% of patients. As you can see, there is a lot of overlap. So if you're sick, it is best to immediately call your primary care physician for further guidance. If you do not have a primary care physician, please call any local primary care physician's office to see if they will give you any advice over the phone or through telemedicine. The Texas Medical Board recently relaxed its guidelines for initial patient encounters to help facilitate this. If you and your primary care physician feel that there is a chance you may have COVID-19, it is time to self-isolate. At this time, it is important that you and your primary care physician call the local health department and inform them of the situation. If you live in an apartment or a house by yourself, just stay at home. If you live with others, you will need your own bedroom and bathroom. Check your temperature multiple times a day and keep a log of your symptoms so that you can inform your primary care physician and the local health department. Use Tylenol for aches and pains and for fever. The World Health Organization, as of March 17th, has recommended that we avoid use of NSAIDs, meaning Aleve, ibuprofen, or aspirin, for the treatment of COVID-19 because there is some data that shows it can cause worsening symptoms and outcomes. The Center for Disease Control has also advised caution in using steroids when patients are under treatment or suspected to have COVID-19. There is some concern that they can prolong the virus. There is also rumors that if you are on an ACE inhibitor, such as lisinopril, you can cause a worsening illness of this virus. However, the American Heart Association and other societies issued a joint statement on March 17th that there is no sound data to support this hypothesis. Please understand that multiple studies are currently in progress and that this data is evolving. I think it's a little premature to issue any concrete guidelines on this at this time. This information is changing daily, and we will keep you informed in future videos. Please discuss with your primary care physician, your cardiologist, your pulmonologist, or your rheumatologist before stopping any of these medications. Use cough drops and cough syrup to relieve your cough. Drink plenty of fluids so you don't become dehydrated. If you start feeling short of breath, dizzy, lightheaded, or feel so weak that you cannot stand up, please call 911 immediately. Remember, 81% of us won't have symptoms or have very mild symptoms, and we can easily recover at home in quarantine. While in quarantine, cover your cough with a tissue and throw that tissue away immediately. Frequently wash your hands or use a hand sanitizer. Wipe down your surroundings with a CDC-approved disinfectant at least daily or a couple times a day if possible. Wear a mask if you need to go outside of your space for any reason, and avoid sharing any items with anybody else. Have groceries, food, and medications delivered to you. Keep in touch with your family and friends through FaceTime. And don't forget to keep your primary care physician updated. Remember, there is still a shortage of tests, and unfortunately, mass testing is still not available. Please understand that even if you have symptoms and concerns, you may still not be tested. However, in the current environment, it is better to err on the side of caution. So when can you come out of quarantine? Per the CDC recommendations, you should have at least 2 negative tests 24 hours apart to show that the virus has cleared. If you were not tested and if you had symptoms, you can come out of isolation after 7 days or when you have had no symptoms for at least 3 days. I personally believe that testing is the best route to go, and as we get more tests, this should be more available. There are already drive-through locations in Dallas-Fort Worth, but please understand that you will need a doctor's orders to get this test done. To keep updated on the latest developments, please subscribe to our channel and share this with your family and friends or anyone who you may feel will benefit from this information. Until next time, bye-bye.